I'll say I'm going to give you a little bit of background on, let's see, on Maywood. And I will say Chief Talley is here, Trustee Booker is here. I see that Dr. Hatchett is here. So these are all colleagues and friends who have as much experience, if not much more, than I do. Let's see if I can get this going. Oh, how do I do it from the non-presenter view? Do you know how to do that? Let's see. Is that better? You can see the full screen now? Okay. Okay. All right, sorry guys, I'm still, even though we're 6 months into this, I'm still not very good at all this. So I'm gonna talk about our Maywood community a little bit in the context of social determinants of health. So as you guys are all starting your medical career, you will be, you're gonna be learning a huge amount of information about the body, about how disease works, how disease start, etc. But one of the things you don't get a huge amount of information on is actually those underlying social factors that significantly impact people's health. And sometimes I think as physicians and medical professionals, we forget about those underlying factors that are shaped by money, power, and resources. They're responsible for huge, social determinants of health are responsible for huge health inequities. And these are conditions that people can't necessarily control by themselves. They're more structural factors. So as you know, you are, if you're not here physically yet, you should have visited. So you know where Maywood is. We're situated just to the west of the city of Chicago. On the east, we're bounded by the Des Plaines River. And then we've got kind of this interesting little, you know, it's not a perfectly square community. And so, and you can see on the red dot or the red star here on the right, and that is where Loyola University Health Sciences campus is situated. So take a look at that map, and then when I show you this next picture, I want you to think about what this means for the community of Maywood, as well as for the people at the medical center and at the Health Sciences campus. It was our buildings and our campus was initiated or started in 1969. So we're talking about a 51-year history now. And to paraphrase Dr. Hackbarth from the School of Nursing, there have never been sidewalks between Loyola and Maywood. And I would argue in the literal sense that is absolutely true. In the figurative sense, I would say in the last 10 years or so, we've been making inroads on that. So I'm going to give you a very short history of Maywood. Before there was a Maywood, there was a stop on the Underground Railroad. This was called the 10-Mile Freedom House. It was situated right along the Des Plaines River at what is now Lake Street. And actually on that spot, there is a McDonald's now. So Maywood has a long history. It has a long history of being an integrated community. And in fact, the community itself was founded in 1869 by a soldier, officer in the Union Army in the Civil War. He and three of his colleagues settled on the west bank of the Des Plaines River. They incorporated Maywood in 1881. And unlike absolutely every other suburb in the Midwest, but pretty much across the entire country, Maywood was founded deliberately as an integrated community. Right from the beginning, African Americans and Jewish people could buy property in Maywood, and this was unheard of pretty much across most of the country for suburbs. There was a synagogue, there were multiple churches, there are still multiple churches in Maywood for sure. It was a thriving community, it was a very prosperous community from the late 1800s to the mid 20th century. And I normally, if we were in person, I would be asking you about now sort of what have you heard about Maywood? What are the impressions that have been given to you or that you have obtained since agreeing or deciding, selecting Stritch as your medical school. And often those responses from students are not very positive. So one of my goals is to show you that for almost any community, there's a long history and there are lots of bumps in the road or trajectories upward that don't have a lot to do with the people who live there. So we had an opera house, we had movie theaters. I've heard we had 3 movie theaters in the town of Maywood alone. None exist anymore. We don't really have a retail district anymore. And so this was an advertisement, the Chicago area from the 1920s. One of the reasons Maywood was so prosperous and a good place to live is that we were right along the railroad tracks. So we became sort of a bedroom community, if you wish. I don't know if you know that term, but basically people could commute into the city for jobs. And then also early in the establishment of Maywood, the American Can Company built their factory here. This was the largest tin can company in the world. It was a very large employer. It occupied a very large land space between 9th Avenue and 17th Avenue along the railroad tracks, along St. Charles Road and the railroad tracks. In 1972, the American Can Company closed down, and with it, 8,000 jobs were lost overnight. So that really was the end, if you will, of any hope of prosperity in that time frame in Maywood. It doesn't mean we're not looking forward here at all. And so, as I said, right from the beginning, Maywood was an integrated community, although the percent of African Americans or Black residents was very low up until the mid-1950s or so. And as you hopefully have learned through your history, in the 60s and 70s, there were a lot of social unrest, obviously, but also social movements and a lot of shifting demographics. So large cities in the United States began seeing or experiencing what's called white flight, where white residents moved out to the suburbs. They embraced that sort of American dream of the house in the yard and being in a community that they felt was safe, etc. During that time, so as white flight occurred in Chicago, and it did significantly, it also occurred in Maywood. And as the white residents moved out, African American residents who were coming through the Great Migration from the early part of the 19th century or the 20th century up through the 60s began moving into Maywood. And so here you can see, and I went through census data for this and pulled up a lot of these numbers. So you can see there's been a shift in our racial and ethnic makeup since the 1930s. And so where we are today is about 65, 68% African American, about 5 or 6% white European, and then the remainder being Latinx and Hispanic. And our Latinx population is growing in Maywood significantly, becoming a really a force in the community. So all of this shifting demographics really played into, as I said, sort of the social changes of the 1960s. Maywood was really at the forefront of a lot of what was happening, particularly at the high school level. Even though in the 1960s or late 50s, only about 18% of the population in Maywood was African American, over 30% of the students at Proviso East High School were African Americans. And Proviso East was the site of some of the very earliest race riots in the late 1960s. Maywood is also the birthplace of Fred Hampton. And here I would have, before I put Mr. Hampton's picture on the slide, I would have said, who has heard of Fred Hampton? Well, Fred Hampton was a very young man, as you can see here. He was a social leader. He was a huge advocate of equal rights, particularly for children, African-American children. When he was growing up in Maywood, he used to take children from the community to other nearby suburbs that had swimming pools and would get these kids into the pool. And he became the Chicago leader of the Black Panthers. He was assassinated, he was murdered by Chicago police and Cook County Sheriff's Office in 1969 in a brownstone on Madison Avenue. He was a huge, he was a good guy. Let's just put it that way. He was a huge leader. He should have lived a long and healthy life. And our aquatic center, our pool in Maywood, is named after Mr. Hampton. So we've been hearing a lot this summer about structural racism and racism in general. I will tell you that this slide has been in in this presentation for many years. So structural racism is a system in which public policies, institutional practices, cultural representations, and other norms work in various reinforcing ways to perpetuate racial group inequities. It identifies dimension of our history and culture that have allowed privileges associated with whiteness and disadvantages associated with color to endure and adapt over time. Structural racism is not something that a few people or institutions choose to practice. Instead, it has been a feature of the social, economic, and political systems in which we all live. And I am going to talk a little bit about sort of the intersection of structural racism, the social determinants of health, and health in our communities. So one of the pillars of one of the domains of the social determinants of health is economic stability. Now you guys, most of you, though I know you, Dr. Hatchett and Dr. Callahan, own property. Most of you don't. However, you could go back and ask your parents about their property tax rate. So these are data from 2 years ago, but they have not changed significantly. If you think about at the bottom of this graph, we have Chicago and Oak Brook, which have the lowest property tax rates in Cook County. And the top 10 communities have the highest property tax rates. So think about this, 22.2% is the property tax rate in Maywood. So I would ask you, again, if we were in a group and I could see you, what do these 10 towns have in common? Anybody? Anybody can just jump out? Okay, no one's feeling like they want to jump in today. These top 10 tax rates in suburban Cook County all belong to communities of color, predominantly African American, low income or low resource communities. But one can argue 22.2%, what's the big deal? The property is less valuable in those communities, correct? But this is a piece of true underlying structural racism that's existed in Cook County for decades. And this is a process called regressivity. So this is a process where for political reasons, the Cook County Assessor's Office overvalues low-priced homes in communities, predominantly communities, Black and brown communities, and they undervalue high-priced homes. Now, why would anyone do that? Well, it's because those people in the high-priced communities are the ones contributing to political campaigns. And so, and the county has to get a certain amount of money. So you have to balance that out. So this has been a known active structural racist approach to funding Cook County for decades. And it was called out 3 years ago. We shall see, we have a new assessor, property assessor in Cook County, so we'll see how that all works. But you could say, okay, well, you have to get your you have to get your taxes. You have to have that property tax to keep your local government functioning, to keep your community functioning, and your public schools. So I will point out that Maywood doesn't really have a business district or a grocery store. Now, when I wrote this, our park district was minimally active. That has improved dramatically. High property taxes result in disinvestment in our communities. On top of that, our schools, if you look at the rankings in both the elementary schools and with the exception of Proviso Math and Science Academy, our 3 high schools, our 2 other high schools in our district, we're not doing well on the education piece either. And I will say, this is absolutely a structural racist, a result of structural racism. And you guys probably don't remember, but in 2008, we started a tremendous depression, recession in this country. And a lot of that was driven by property lending and bank loans to individuals with predatory interest rates. 25% of the homes in Maywood since 2006 have gone into foreclosure. So think about that. 1 in 4 houses. On my block, I've had 3 that have gone into foreclosure since 2008. And sort of to top off those pieces that our residents have to deal with is that Maywood has the 3rd highest water rate in Cook County. This is a story, again, 2017 was a very big year for the Chicago Tribune, sort of outlining some of the inequities that are seen in Cook County. And this gentleman is a Maywood resident. The story was specifically about the burden that Maywood suffers. And again, this was our rates are determined by our politicians, basically. And again, it's to meet financial need. However, there needs to be more creative governance around that so our residents don't end up carrying the burden of this. And then, unfortunately, we do have a concern with violence in our community. And those of you who are just starting at Loyola will learn about Loyola Stands Against Gun Violence, which is an interprofessional group that Ginny McCarthy and Lucia Garcia lead. And we are, and I'm part of that group. We would absolutely love to have everyone be part of our committee. But what I will say, we've looked at the data for the emergency department at LUHS, and we know that 18% of all admissions between 2007 and 2018, now think about this, all admissions for gun violence were from the community of Maywood. And then we also have an issue with healthcare access. Now, we like to think at Loyola that all of our residents would, of course, come to Loyola for healthcare. And in fact, that's not the case. Westlake Hospital was the hospital of choice for the vast majority of Maywood residents. Westlake is right on the border of Maywood and Melrose Park and on the north side of the community. It was shut down. Again, because of financial reasons. It was purchased by a large healthcare system, and despite promising when they purchased the hospital that it would stay open, in fact, within 2 weeks of the signing of the deed, they closed that down in our community. And we also have high food insecurity in Maywood. And as Dr. Hatchett and her group Proviso Partners for Health, they've been instrumental in making sure, particularly during these times of COVID, that they are getting food to individuals in Maywood who need that support, particularly now. And they have a big focus, Proviso Partners for Health have a big focus on food justice. So if that is a topic you're interested in, I'm sure Dr. Hatchett will speak in a bit also. And so what do all of these factors mean? It means that we have some of some real challenges in regard to our health. So these are data from the Cook County Department of Public Health. I'm not going to go through all of these. I'm just going to point out that we have a lot of challenges. We have low income. We have a high proportion of our residents living below the federal poverty line. We have a high proportion of cost burden households and Medicaid recipients. And this really, when we look at this, particularly with regard to maternal and child health, we have some really not optimal health outcomes. A high proportion of teen moms, single moms, low birth weight babies, and an obscenely high infant mortality rate, which is tied into a lot of these other factors. And I have these slides in here, but I don't want to belabor the negative aspects of Maywood, or the challenges. I won't say negative aspects at all. They're challenges of Maywood. But if anyone is interested, this is it's now 4 years old, but it's the health impact. It's a health needs assessment for the central region of Cook County, of which Loyola is part. Really quickly, we have some of the highest unemployment rates, poverty rates. I'm going to talk a little bit more about COVID-19 in a minute, and how all of this, these pieces all play together, and nothing really exists in isolation. I should have trimmed some of these slides down, so I apologize, but it always fascinates me, right? So we have, as expected, we have fairly high rates of chronic disease, but not too tremendously different than most other communities of color. And I will say, if we take a look at these 4 communities listed here under suburban Cook County, Bellwood, Cicero, Maywood, and Melrose Park, these are going to play a very large piece in our COVID-19 burden. So these are communities with high burdens of chronic diseases, and those the chronic diseases are heart disease, cancer, stroke, and diabetes. Okay, so keep your eye on those 4 communities in particular. Bellwood and Maywood is Bellwood is also a largely African-American community. Melrose Park, Cicero, and Berwyn are largely Latinx communities. So again, our brown and Black communities are carrying a huge amount of health burdens, as well as structural inequities. So this one is always so depressing to me. I don't know if any of you know exactly where River Forest is. So if we take a look at Maywood here, so these are lowest life expectancies in suburban Cook County on the right, and highest life expectancies in suburban Cook County on the right. Maywood and River Forest are literally separated by the Des Plaines River. So I want you to think about that. We are literally separated by the Des Plaines River. If I go 5 blocks to my east, cross the bridge on Chicago Avenue or Lake Street, I am in River Forest. So I go from one of the lowest life expectancies in western or central western Cook County to the highest, or one of the highest life expectancies. So for me, that is always such a striking dichotomy. And I'm not going to go over this except to say we've been working in Maywood and in epidemiology, as well as multiple sites around the world for a long time. And so these are 2 studies that we've conducted 20 years apart about, and what I would say is, so if we take a look at like percent of hypertension amongst men in 1992, and these are men who are 25 to 45 years of age. These are young adults, okay? These are young adults. The prevalence of hypertension was 14% amongst men, and that's increased in 2010 to 33%. Comparable amongst women. And if we look at the proportion of obesity, we see that amongst men it was about 23%. That's doubled to 46% in amongst women in Maywood, and again, young women and young men, from 42% to 67%. My point in bringing up these data are that we are not getting better. Despite a lot of research, we are not obviously doing the right interventions to get this, this ship turned around, if you will. Okay, so let's talk a little bit about COVID-19. You can find these data in the Cook County Shiny app. They're updated daily, I believe, certainly weekly, if not daily. So as I said, these communities of color that are in Loyola University Health System service areas or coverage areas. So again, they're Bellwood, Maywood, Melrose Park, Cicero, and Berwyn. Oops, sorry. These communities account for 17.1% of the confirmed COVID-19 cases in suburban Cook County. 17.1% of all cases in suburban Cook County come from these 5 communities. These 5 communities make up only 8% of the population of suburban Cook County. Clearly, something's inequitable here, right? And it's the same if we look at numbers, counts, or rates. And so I'm just, these data now are a month and a half old, but they've only gone up. So if we take a look, so the rate of cases are those number of cases per 1,000 population. So this is how you take numbers from case counts, which might not mean a whole lot, or they might look tremendously high or low, etc. But you can't really compare to between communities until you adjust for a population. So here for most epidemiology on infectious disease or even chronic disease, we look at it, the number of cases per 100,000 population. So as you can see, Melrose Park, and as of last weekend, Melrose Park's case rate was over 4,000. So Melrose Park, Cicero, very, very high case rates, large Latinx populations. Maywood and Bellwood right behind. Now I will point out, again, Maywood is just 2 communities away from Oak Park, where we have about a quarter of the case rate. Forest Park, about half of the case rate is Maywood. And same for River Forest, and Hinsdale also. So why do you think that might be the case? What might be driving these differences across these communities that are right next to each other? This is an infectious disease. Any ideas? You can just speak out. Or I don't know, actually, Jenny, people can
speak out, or they can chat. If you want to drop something in the chat, you could also do that.
Any idea? Anything, Jenny?
Yes, the increased lots of ideas, great. Increased population working essential jobs equals increased exposure, types of jobs, living with extended family, people are going out for shopping or work, can't work from home, access to healthcare.
Exactly. All of those things are at play, right? Exactly. Very good. People, you guys have been reading up on your COVID-19. That's wonderful. So this, I can't even remember. I know I have a citation here that I can't see because of my toolbar, but this is an interesting graphic, I think, because it really illustrates the types of jobs that people, you know, in sort of this infographic style where it's kind of easy to visualize the differences, right? So folks who live in River Forest, yeah, they can stay at home for the most part. Or if they do have to go into their offices, they probably have offices where they can close the door and be socially distant and follow all the rules and regulations, which is phenomenal. And then on the left, we have Maywood. And in fact, most of the folks in Maywood, first of all, we have a large proportion of elderly folks in Maywood. So we have congregate settings. So that doesn't have to do with occupation, but it has to do with social distancing, living in large communities, or communities with, or residences with large populations. But the jobs do tend to be things that have been labeled essential. And you guys hit the nail right on the head. That's absolutely right. And so then I'm going to pull up, this is Cicero. Again, a large Latinx population, same comparison to River Forest. So I'm a very visual person. And so for me, these graphics explain a lot about what's going on. These, you know, a lot of our residents have to take public transportation, very limited opportunity for social distancing, etc. And yes, not many have Peapod or Whole Foods delivered to their groceries to their home, right? And so some of us have been very lucky. I live in Maywood, and yet I've been extraordinarily lucky that I have a job where for the first 3 months, I literally don't think I left my house, or certainly not my block. And I definitely have that privilege. And then I'm just going to finish up here by linking back to our very minimal discussion about gun violence in Maywood. Now, granted, this is the city of Chicago, but it certainly can extend to our community here in Maywood, and that is that very few things occur in isolation. These social determinants of health underlie so much of what's happening in our communities. And if you take these maps on gun deaths, income, race, and COVID-19 for the city of Chicago, you can pretty much overlay them. So Black and brown communities actually, you know, our former chairperson, I guess I'm the chair now, the former chairperson this weekend, when I shared with him the results of our testing in Maywood and Melrose Park. We're doing COVID-19 testing in the community with a collaboration of interprofessional professionals and students at Loyola called CERCL, C-E-R-C-L, look us up. But we've been testing in the community because we don't have community level testing in our towns. We've started the last 2 weeks. We've had 2 weeks, shared the prevalence data with our former chair, Dr. Cooper, and his response was, it's time for an insurrection. It's time for a demonstration. This is structural racism at its worst. So we are carrying this burden of COVID-19. And hopefully with you guys being involved, we can make a difference. We're trying, but we need more bodies, frankly. So this is, you know, how I end this whenever I talk to first-year medical students. So the next time your Maywood or Melrose Park or Berwyn or Cicero or Bellwood patient tells you that she hasn't taken her medications, don't immediately jump to the non-compliant patient model. I really urge you to dig a little bit deeper to understand her situation a little better. And I know that's hard in a 15-minute medical visit, but it's absolutely critical for you to be able to be a better doctor to your patients. And I will say there's a lot of joy in Maywood. As Lucia said, I've lived here for 18 years with my family. I'm raising my son here. It's a good community, and I'm really happy to be here. And so with that, I will leave you. Well, I won't leave you, but we can stop and see if anyone has any questions. I'm going to stop sharing, okay?